When you are happy with your occlusal reduction, instruct the patient to close their teeth together to ensure they have sufficient clearance. Insert a periodontal probe into the occlusal clearance to check this. If rubber dam is in situ, as is the case following a pulpotomy, it is often not possible to get the patient to close their mouth. In this situation, you will need to gauge occlusal clearance visually. Assess the contact points to determine if space is required for seating the crown. If required, the tooth may need to be prepared to eliminate any proximal contacts. If at all possible, this should be avoided as there is potential for iatrogenic damage to the adjacent teeth when eliminating the contacts. Using a high-speed handpiece with a long parallel-sided burr, eliminate the appropriate proximal contact. To do this, cut a slice. Carefully consider pulpal anatomy in order to avoid pulpal exposure, or make an active decision to carry out a pulpotomy where removing a large amount of tooth or caries will further stress the dental pulp. For the purpose of this exercise, we are using the tooth that has previously had a pulpotomy procedure undertaken. Leave a thin wall of enamel in place between the adjacent tooth and the burr during preparation. This is removed last. Dry the tooth and assess for adequate preparation. Use a periodontal probe to measure the mesiodistal width between adjacent contact points and use this to aid in the selection of the correct size stainless steel crown. Select the correct crown. Unlike the hole technique, in this case the crown should fit easily over the tooth. You may not observe spring back. Try the crown over the tooth. For this, the patient should be semi-recumbent. It is imperative that the airway is protected to prevent aspiration of the crown. Ensure the crown fits over the whole occlusal table, but does not cover either of the adjacent teeth. Carefully determine the path of insertion. The crown should fit passively over the tooth from a lingual buccal direction. If necessary, a crown may require adjustment with the crown forming pliers. This will be demonstrated in your practical. Rehearse the path of insertion. Do this until you are confident that you can undertake this procedure with ease. Ensure that the child is comfortable. Load the crown with a glass ionomer lutein cement to approximately 1 to 2/3 of its capacity. Use a flat plastic to ensure that the internal surface is completely covered by the cement. Dry the tooth. Isolate the tooth and achieve moisture control. Use cotton wool rolls or dry guard. Ensure that the cotton wool rolls are controlled when in the oral cavity. If rubber dam is in situ, this will serve to achieve moisture control. Importantly, a split dam technique should be used as you do not want the dam interfering with crown seating. Place the crown onto the tooth from a lingual to buccal direction, applying firm pressure. Quickly remove any excess cement with a cotton wool roll and remove the lingual cotton wool roll. Keep pressure on the crown for a further 60 seconds. After a further 30 seconds to 1 minute, remove